So, good afternoon, Doc Yang and classmates. Our topic for today is all about brain damage and neuroplasticity. So, here are its contents: the causes of brain damage, neurological disease, animal models of neurological disease, response to nervous system damage, degeneration, regeneration, reorganization, and recovery. And lastly, we have the neuroplasticity and the treatment of CNS damage. So let's start first with brain damage. So brain damage is an injury that causes the destruction or deterioration of brain cells. So once na ay deterioration of brain cells, lugos na gyud mo function ang brain unlike the normal ones. Next, we have the causes of brain damage. First, we have brain tumor. Second, we have cerebrovascular disorders, stroke. Third, we have closed head injury. Fourth, we have infection of the brain. So, let's start first with brain tumors. Muni pinakauna. A tumor or neoplasm, literally new growth, is a mass of cells that grows independently of the rest of the body. About 20% of tumors found in the human brain are meningiomas. So, ang ubang mga brain tumors kay usually hereditary, napasa from parents to offspring. We have cerebrovascular disorders or strokes. Strokes are sudden onset cerebrovascular disorders that causes brain damage. In the United States, stroke is the fifth leading cause of death, the major of neurological dysfunction, and leading cause of adult disability. So, unsa may symptoms ani niya? So, symptoms of stroke depends on the area of the brain affected, but common consequences of stroke are amnesia, aphasia or language difficulties, paralysis, and coma. Diarrhea of dead or dying tissue produced by a stroke is called end infarct. Surroundings infarct is a dysfunctional area called the penumbra. The tissue in the penumbra may recover or die in the ensuing days, depending on a variety of factors. So, kaning stroke, magadepende jud kung unsang area sa brain ang naapektuhan jud sa imong brain. Usually, it will cause to amnesia, aphasia, language difficulties, paralysis, and coma. So, there are two major strokes, namely cerebral hemorrhage. Mo-result siya into cerebral hemorrhage. Bleeding in the brain occurs when a cerebral blood vessel ruptures and blood seeps into the surrounding neutral tissue and damages it. Next, we have the cerebral ischemia. It's a disruption of the blood supply to an area of the brain. The three main causes of cerebral ischemia are thrombosis, embolism, and arteriosclerosis. So first, let's deal with cerebral hemorrhage. Mahitabo ni tungod sa aksidente, mga brain tumor, stroke, or high blood pressure caused by other health conditions. While ang ischemia, padulngan ani kay limited ra ang oxygen supply. So let's move forward. The third, we have closed head injuries. So brain injuries produce blows that do not penetrate the skull are called closed head injuries. Contusion are closed head injuries that involve damage to the cerebral circulatory system. Such damage produces internal hemorrhaging, which results in a hematoma. A hematoma, on the other hand, is a localized collection of clotted blood in an organ or tissue, in other words, a bruise, so mga samad. It may surprise you to learn that contusion frequently occur on the side of the brain opposite the side struck by a blow. The reason for such so-called contra-coup injuries is that the blow causes the brain to strike the head, to strike inside of the skull and on the other side of the head. When there is disturbance of consciousness, the imong consciousness mabothered or it's being disturbed, followed by a blow to the head, and there's no evidence of contusion or other structural damage, the diagnosis is concussion. It once assumed that a concussion entails a temporary disruption of a normal cerebral function with no long-term damage. So, kaning closed head injuries, makakos ni siya og broken bones to the skull or face o brain damage. Kung ma-brain damage, pwedeng masamaran siya nga makakos sa bleeding in and around the brain. So next, we have the infection of the brain. Encephalitis is inflammation of the active tissues of the brain caused by an infection or an autoimmune response. The inflammation causes the brain to swell, which can lead to headache, stiff neck, sensitivity to light, mental confusion, and seizures. So symptoms can include headache, fever, mausob imong consciousness, dayon confusion, maglibog ka, neck stiffness, vomiting, magsuka-suka, seizures, weakness, trouble moving, and changes in vision. So mao din siya ang swelling of the brain, and it's either viral infection or the immune system attacking the brain tissue. Next, we have the neurotoxins. Neurotoxins are toxins that are destructive to nerve tissue, causing neurotoxicity. The nervous system can be damaged by exposure to anyone of a variety of toxic chemicals, which can enter general circulation from the gastrointestinal tract, from the lungs, or through the skin. So there are three kinds of neurotoxins: toxic psychosis, crackpot, endogenous, not indigenous. So, kani siya, mo damage ni siya sa imong brain cells o kanang nerves nga mo carry og signal around sa imong body. Next, we have the genetic factors. So, some neuropsychological disease of genetic origin are caused by abnormal recessive genes that are passed from parents to offspring. Like, we have Down syndrome, sometimes called Down syndrome is a condition in which a child is born with an extra copy of their 21 chromosome. Hence, in its other name, trisomy 21, this causes physical and mental developmental delays and disabilities. So, sa may cause ani niya, mga 95% of the time, Down syndrome is caused by trisomy 21. The person has 3 copies of chromosome 21 instead of the usual 2 copies in all cells. This is caused by abnormal cell division during the development of the sperm cell or the egg cell. So mauna ang usa ka tawo or individual magka-Down syndrome because of the abnormal gene di ay nga we inherit, the person or the individual inherit from the parents and is being passed down to an individual. So, usually humans have 46 chromosomes all in all, diba? And 23 pairs. Then it was stated here instead of usual 2 copies in all cells. But in this case, there was abnormal cell division during the development of the sperm cell and the egg cell. So, Down syndrome, abnormal gud siya kay naa siya 3 copies of chromosome 21. Next, we have programmed cell death. Apoptosis is as predefined suicide cell where the cell destroys itself, maintaining a smooth functioning of the body. Then, necrosis is known to be a kind of cell death where the cell dies in an untimely way due to some uncontrolled external factors. Kung ang cells dili na kinanglanon, so mag-suicide pud ni sila. Next, we have the epilepsy. The primary symptom of epilepsy is the epileptic seizure, but not all persons who suffer seizures are considered to have epilepsy. This is true. So, it's very true po na not all persons who suffer epilepsy kay one symptoms anan niya is mag-seizure. Also, what we call the hypoglycemia, which is low in blood sugar. Ang pinaka-low jud kayo nga victims ani kay ang mga infants or mga newborn babies. Because at an early stage, they show symptoms of seizures and manggahi sila. And usually, dali arang gutumon. And symptoms show in newborn babies nga hinay kay sila ginilakan. So, what is the main cause of epilepsy? So, when epilepsy is diagnosed in older adults, is sometimes from another neurological issue like stroke or brain tumor. Other causes can be related to genetic abnormalities, prior brain infection, prenatal injuries, or developmental disorders. But in about half of the people with epilepsy, there's no apparent cause. So, treatments include medicines called anti-epileptic drugs, AEDs, surgery to remove a small part of the brain that's causing the seizures, a procedure to put a small electrical device inside the body that can help control seizures, a special diet, ketogenic diet that can help control seizures. So, kani siya usa ka brain disorder, dili gyapon normal ang functioning sa brain ani because of the seizures can cause change in the brain activity. Next, we have the neurological disease. Parkinson's disease is a brain Parkinson's disease is a brain disorder that leads to shaking, stiffness, and difficulty with walking, balance, and coordination. Parkinson's symptoms usually begin gradually and get worse over time. As the disease progresses, people may have difficulty walking and talking. One of the most controversial treatments for Parkinson's disease is deep brain stimulation, a treatment in which low-intensity electrical stimulation is continually applied to an area of the brain through stereotaxically implanted electrode. Deep brain stimulation (DBS) delivers electrical impulses to a targeted area of the brain that is responsible for the movement symptoms, also called motor symptoms, caused by Parkinson's disease. The electrical impulses disrupt the abnormal activity that occurs in the brain circuitry, which is causing the symptoms. So, I have a question. Can Parkinson's disease be cured? Unfortunately, the answer to that is that Parkinson's disease cannot be cured. But there are medications that the patient takes in order to help control the symptoms that the person is feeling or having or experiencing during the time that this disease is occurring. So next, we have the Huntington's disease. Huntington's disease is a fatal genetic disorder that causes the progressive breakdown of nerve cells in the brain. It deteriorates a person's physical and mental abilities, usually during their prime working years, and has no cure. So just like Parkinson's disease, also this disease have no cure. Symptoms shows that there is slow and abnormal eye movements, impaired posture and balance, and they have difficulty in speech. So next we have Alzheimer's disease. Alzheimer's disease is a progressive neurologic disorder that causes the brain to shrink or gamay and brain cells to die. Symptoms may include increased memory loss and confusion, inability to learn new things, difficulty with language and problems with reading, writing, and working with numbers, difficulty organizing thoughts and thinking logically, shortened attention span, problems coping with new situations. So usually people with Alzheimer's, usually the beginning of this, it varies. But the symptoms first appear in between 30s to 60s. Next, we have the responses to nervous system. Next, we have the animal models of human neurological disease. Under this, we have two, the kindling and the transgenic. So first, we have the kindling model of epilepsy. The kindling model involves brief but repeated stimulations that evoke electrographic seizures or after discharges ADS, as was first reported by Goddard et al. In the late 1960s. Repeated stimulations kindling are accompanied by prolongation of the AD duration and increase in severity of behavioral seizures. And next we have the transgenic mouse models of Alzheimer's disease. Perhaps the most promising step forward in the study of Alzheimer's disease has been the development of several transgenic models of the disorder. In transgenic mouse models of Alzheimer's disease, gene mutations that promote the accumulation of human in the substantia nigra and a major reduction in brain dopamine. So what is the difference between the two? Kindling, lasting change in the brain function siya, while ang transgenic mouse models have had their genomes altered for the purpose of studying gene functions. Next, we have the responses to nervous system damage, degeneration, regeneration, reorganization, and recovery. So, let's start first with neural degeneration. The neural deterioration, and that is a component of both brain development and disease. So there are two kinds of neural degeneration. First is the anterograde degeneration. So mahitabo ni siya kung ang nerve fiber axons kay na damage. The second one is the retrograde degeneration. So if ang anterograde degeneration occurs when the nerve fiber axons are damaged, then this is the one that is away from the cell or in the site of injury. That is the retrograde degeneration. Next, we have the neural regeneration. It is the regrowth of damaged neurons, does not proceed as successfully in mammals and other higher vertebrates as it does in most invertebrates or lower vertebrates. Neural regeneration within CNS versus the PNS. So in the central nervous system, axons do not spontaneously regenerate after injury in adult mammals. In contrast, peripheral nervous system axons readily regenerate, allowing recovery of function after peripheral nerve damage. So here, in neural regeneration, simply mo regrow ang damaged neurons, while a neurological reorganization addresses the challenge of a disorganized or injured brain. Next, we have the neuroplasticity and the treatment of CNS damage. So, neuroplasticity refers to the lifelong capacity of brain to change and rewire itself in response to the stimulation of learning and experience. Neurogenesis is the ability to create new neurons and connections between neurons throughout a lifetime. So simply, in neuroplasticity, our brain has the ability to form new connections. Next, we have promoting recovery CNS damage by rehabilitative training. Several demonstrations of the important role of experience in the organization of the developing and adult brain kindled a renewed interest in the use of rehabilitative training to promote recovery from CNS damage. So first, we have treating strokes. So for example, ang isa ka individual na ischemic stroke, i-treat niya sa doktor kauban ang ubang medicines used for such as blood thinners as well as surgery to remove the clot. So that is how the stroke is being treated. The next, we have the treating spinal injury. So you might need a traction to stabilize or align your spine. Options include soft neck collars and various braces. So next, we have the benefits of cognitive and physical exercise. So ang individuals who are cognitively, kanang mentally and physically active jud are less likely to have a neurological disorders. Pero kung manaa sila, ang symptoms kailang ma-feel, it is less severe, dili kayo grabe, o makarecover dayon ni sila dayon because of the mental stimulation and the physical exercise that they perform. So, next and last, we have treating phantom limbs. So, most amputees ka ng mga pungkol, mo continue sila to experience to have that amputated. So, most amputees continue to experience the limbs that have been amputated. A condition, mo ni siya gitawag na to og phantom limb. So, that will be the end of my report. Thank you for listening.